Michelle. I'm the D4. My journey to down school was back in 2018 when I moved to America to join down school at UF. I applied to the BSDMD 7-year program at UFCD and I got in and I made it to the seventh year. Here I am.
Hi guys, I'm Natasha. I'm a second year dental student right now. And similar to Michelle, my journey also started in the end of my freshman year when I applied to UF as a BSDMD student and I got in. So here I am.
Pretty much, yes. I always wanted to be a dentist. I love the work-life balance a dentist has. And it's so much to do with your hands. It's like art and crafts inside a patient's mouth and making so much different in all the lives we are a part of. So yes, I always wanted to do dentistry.
For me, I did not always know that I wanted to be a dentist. It was a bit of a learning curve to get there. Michelle getting into dental school was definitely a big motivating factor for me. I have always been following Michelle's footsteps, and just her starting dental school was like paving the way for me, basically, and I just followed in her footsteps.
I wouldn't say difficult, but challenging was gross anatomy. I had a hard time doing the dissections and memorizing all the structures, but overall, I figured it out in by the end, thankfully. But I would say gross anatomy. I really liked hand skill courses like anatomy, dental anatomy, but gross anatomy was the one that challenged me a bit.
For me, it was the complete opposite. For me, gross anatomy was my favorite class. I would say in all of dental school, it's been my favorite class so far. And the class that I took Michelle's help for the most part was the hand skill classes, so probably operative or dental anatomy. And it wasn't really challenging, but I always appreciated that she just loved that subject so much and she could teach me so much from it.
My favorite class was operative too. I felt like I was so much more happy doing amalgam and doing composites, doing those complex fillings. I would say operative two was my favorite course, and I would love to take it again with Dr. Terza. She's the best.
My favorite class was probably Op 3. So it was Operative 3. It was more of the aesthetics uh, subject. It was more dealing with the aesthetics, so like veneers and like more of your anterior teeth. And I really liked that it could really change a person's smile and the ability that I could do it one day. And it was really cool.
I would say I would let you go ahead first on that.
Yeah, I take a lot of help from her. I would say that she is my number one help in dental school. I do not go to Safari or look up notes on lecture. The first person that I call is Michelle, and she always has all the answers. So yeah, she does mentor me a lot.
Except gross anatomy. That's the one place where she mentors me. But honestly, we both learn very similarly. So anytime we have an exam coming up and the other one's free, we always quiz each other. And because we're in the same field, we are always both in line arguing or discussing new theories, new topics in our field.
Yeah, we also did research together. So we were on a research project together, and we just learned so much together. And I discovered that we learn by discussing things, and we are always discussing something or the other.
For me, as I said, the work life balance of a dentist appealed to me a lot. And on top of it, being able to impact on somebody's life with all the hand skills, all the. I feel like dentistry is also being like a therapist for your patient, making sure that they're happy in what they have and are taking care of their health. And now I'm gonna try and do orthodontics, so more in the line of being able to make my patients more confident.
For me, it was kind of similar to Michelle, so definitely the work-life balance and all of that, but also because just having the ability to construct something, it really excites me, and the anatomy of the head and neck, it really excites me so much, and the ability to reconstruct all of that in a patient's smile and to rehabilitate a patient's whole dentition, it just drives me crazy.
So I do want to specialize. I got into the UF orthodontics residency, so I'll be starting that this July. There's just something about aligning teeth, removing all those spaces, and creating an even and balanced smile that pushed me to get into orthodontics.
I do also want to specialize, but my field is kind of similar to Michelle, but not really. It's like the complete opposite, some would say, or it's kind of linked with it, but it's oral surgery. And they go hand in hand with each other. So hopefully I get to work with Michelle in the future.